Hey everyone, and welcome back to the channel. Today, we're diving into something truly incredible. Something that's quietly revolutionizing how we stay healthy. Imagine walking into a hospital where your doctor doesn't just rely on their incredible experience, but also has a tireless, ultra-attentive assistant by their side. This assistant can scan millions of medical images in mere seconds, recognize patterns invisible to the human eye, and whisper the earliest hints of disease long before symptoms even appear. Sounds like science fiction, right? Well, that assistant is artificial intelligence, and it's already transforming how we diagnose illness. Breakthroughs published in top journals like Nature Medicine have shown that AI systems can detect everything from lung cancer and heart disease to diabetic eye damage with astonishing precision. And the really fascinating part, these systems don't just memorize medical cases. They learn. They pore over vast libraries of X-rays, CT scans, and Mr. Is, training on hundreds of thousands of examples, each meticulously labeled by experts. Over time, their neural networks begin to notice the faintest details, a subtle shadow, a tiny distortion, a texture difference. Those tiny clues that might hint at an early tumor or infection. To understand this, think about how you teach a child to recognize a cat. You show them pictures from every angle, in every color and size. At first, they might mistake a fluffy dog for a cat. But with enough examples, they start to grasp the deeper features, the shapes, the ears, the whiskers. AI learns in a similar way, but it doesn't need years. It can process and analyze millions of examples in days. In radiology, AI has become like a second pair of eyes. Deep learning models can now examine chest X-rays and pick up early signs of tuberculosis, pneumonia, or even COVID-19 before they become severe. In one remarkable study, an AI system trained on over 1 million mammograms was able to spot breast cancer cases that human radiologists missed. It wasn't because the doctors were careless, but because the indicators were so subtle, a barely perceptible change in brightness or texture that even a highly trained eye might overlook. Think of it like this, where human perception hears the main melody, AI hears the faintest background notes that signal something deeper. What's truly revolutionary is how these systems augment human skill rather than replacing it. A doctor might use AI as a kind of diagnostic compass, an alert system that highlights suspicious areas on a scan, essentially saying, "Hey, take a closer look right here." This powerful collaboration of human judgment and machine precision can dramatically reduce errors, speed up diagnosis, and even make healthcare more accessible in parts of the world where specialists are scarce. Take ophthalmology. For example, AI algorithms can examine retinal images and detect diabetic retinopathy, a leading cause of blindness within seconds, allowing patients in rural areas to receive early warnings and treatment. In cardiology, AI can read echocardiograms and electrocardiogram, detecting signs of heart failure or arrhythmias long before a person even feels unwell. And in pathology labs, algorithms sift through digital microscope slides, finding cancer cells hidden among millions of healthy ones, truly a microscopic needle in a digital haystack. But what makes AI truly exciting isn't just speed or accuracy, it's its ability to discover patterns we never knew existed. These models sometimes notice associations that even seasoned researchers didn't anticipate. For instance, some AI systems trained on eye scans have learned to predict a person's age, blood pressure, and even their risk of heart disease, purely from patterns in the retina. It's as if the eye quietly carries a map of the body's health, and AI is decoding it for the very first time. Now, like any powerful tool, AI does have limitations. It can make mistakes if the data it learns from is biased or incomplete. A system trained mostly on patients from one country might not perform as well in another with different populations. That's why doctors still make the final call. Because medicine isn't just about data. It's about people, context, and compassionate care. Researchers are also working hard to make these systems more transparent, so that when an AI says, "I think this scan shows a tumor," it can also explain why. This transparency is vital for building trust, both between doctors and their digital partners, and between patients and technology. As AI continues to evolve, we might soon enter an era where disease detection is proactive rather than reactive. Imagine a world where algorithms continuously monitor subtle biological signals, predicting illness long before it even begins. Your smartwatch or phone could quietly scan your health data every day, alerting your doctor at the first sign of trouble. It sounds futuristic, but the foundations are already being built in labs and hospitals worldwide. So, the next time you see an X-ray or medical scan, remember, behind that grayscale image might be a powerful network of algorithms tirelessly searching for clues that no human could ever find alone. Artificial intelligence isn't replacing the doctor. It's redefining what it means to care. And perhaps, in this incredible partnership between human intuition and machine intelligence, we're witnessing the beginning of a new kind of medicine, one that listens more closely, sees more deeply, and heals more wisely than ever before. What do you think about AI in healthcare? Let us know in the comments below. If you found this video insightful, please give it a big thumbs up, share it with a friend, and don't forget to subscribe for more fascinating content like this. Thanks for watching, and I'll see you in the next one.